Good morning. Wow, that's loud enough. Nice to see so many of you. There are lots of spaces up here in front if you want to come closer, so please feel free to do that. I have a few practical announcements. One is that checkout time at the hotel is at noon. And if you want to check out and you have some luggage that you would like to store, then there's a room the opposite end of this hallway where you can put your stuff and it'll be safe. It's called Atlanta, that room. Then I'll get us slowly starting and give just a very brief introduction to perfusion imaging and how the kind of perfusion imaging we will be talking about today and that some of you have learned about the past during the workshop yesterday, how that ties in with the kind of perfusion imaging that you have probably read about previously. So when we today look at perfusion, it's to find out how much oxygen is available in tissue. And we use that with a bolus injection of gadolinium and turn that into maps of, in this case, the brain, cerebral blood flow. So that's the oxygen supply to the tissue. We also get a map out of blood volume, the density of microvessels, and then finally the ratio of the two, which is the mean transit time of blood. So I call that classic perfusion MRI. It is so old that I think I'm the only one alive who still remembers it. What we overlooked back then in terms of whether we actually address oxygen availability is the fact that the capillary distribution of blood affects the extent to which oxygen can be extracted from blood. So the blood supply still determines how much oxygen comes into the tissue, but the microvascular distribution of blood determines how much can be extracted. You can see it here, that here's a homogeneous distribution of blood, here's a heterogeneous one, and what you can see is that some of the blood passes through the capillary bed so quickly that tissue doesn't have enough time to extract its oxygen content before it leaves through the vein. So OEF, the oxygen extraction, is lower, it's poorer when you have heterogeneous flows. So that's the parameter we need to know. You already heard about the mean transit time. So that's essentially an expression of blood flow with the volume you have. But what we also need to know is the standard deviation of transit time, essentially to address this distribution of flows and thereby to come by what oxygen extraction is. So what we overlooked is that to estimate tissue oxygen access, we used to think that now when we know blood supply, we know oxygen delivery, but CTH, that extra parameter, determines the extent to which oxygen can be taken up by the tissue. In disease, that has huge implications because we used to think that if you have a vascular disease, it's probably because your blood flow is impaired, but there's another reason. If capillary flows are disturbed, you can have shunting of oxygenated blood to such an extent that tissue cannot extract it. So that can be as severe. So that's what's illustrated here. It's not because individual capillaries, if they become occluded or something, they don't stop blood flow, but they may divert blood to other capillary paths. And then you have very poor oxygen extraction because those transit times become so short. And we'll hear about this, an example of how in disease capillaries can become occluded. And we can have a source of hypoxia that we cannot see or could not see. We could not see it by CBF measurements because that may not block blood flow at all, but it hinders oxygen uptake. That's why it's so important. So Kim developed the method that's now available to determine CTH. This is an example of the old MAPS, CBV, and mean transit time in a patient with a carotid stenosis, and here after treatment. And what you can see here is that because of risk factors and the low flow, capillary flows are also affected. So it means there's also a hypoxia or low oxygen tension in tissue because capillaries are affected, in addition to what we can fix surgically. So modern perfusion software provides the classical parameters I showed you in the very beginning, but also the new parameters that came out of Kim Morrison's work. And then finally, it allows, based on those two, CTH and MTT, it allows you to predict what is the oxygen extraction that is possible with this hemodynamic situation. So it doesn't measure oxygen directly, but it tells you biophysically how much oxygen can you extract. And then if you multiply that by the blood flow, you of course get an estimate of what the steady state CMRO2 might be. So that's what's new. And I look so much forward. This is a research area that has really increased over recent years. So from year to year, there are some very exciting results. And you'll get to hear many of them for the first time, some of those exciting results.